My son was born with a severe congenital heart defect. When he was first born, he was in the ICU, and all the nurses at the bedside literally kept him alive until all the surgeons could get there. And I saw the nurses taking care of him, and I said, this is what I need to be able to do. I've done the bedside nursing to now trying to advocate for patients and other nurses.
I have realized that there's so much more that connects us, more than divide us in so many ways, no matter where we come from and so on.
You'd be surprised at how many in the community do not know their blood pressure. It's incredible to be able to do what I do. It is life-altering and changing. Told my son many, many times. He has saved so many people through me. He was born, which gave me a purpose, and follow your dream, follow your heart, follow your passion, purpose, and take care of patients, because it's a wonderful thing to be able to.
Welcome to Rosabel Unscripted, the podcast where authenticity meets real life stories. I'm your host, Rosabel Zohfeld, and in each episode, I dive into unscripted conversations about personal growth, life challenges, and the experiences that shaped us. From heart-to-heart chats with inspiring guests to raw moments of self-discovery, I am here to share stories that connect us all. Whether you're seeking motivation, healing, or simply a dose of real talk, you are in the right place. So get comfortable, tune in, and join me on this journey of transformation, empowerment, and meaningful conversations. This is Rosabel Unscripted. Hello, everybody, and welcome back to another episode of Rosabel Unscripted podcast, where we dive into real stories behind health and hope. I am your host, Rosabel Zohfeld, nurse practitioner, educator, and mom. And today's episode is really special, close to my heart, because I'm joined by a nurse practitioner as well. Her name is Monica Sanford. Hello, Monica. How are you?
Hey, thank you for having me.
My pleasure. So welcome to the show. I am so excited to chat with you. So why don't we start at the beginning? You and I, it seems like we both became nurse practitioners because we were inspired by deeply personal journeys. So can you tell us, for you, what was that the first drew you into nursing?
My son was born with a severe congenital heart defect. When he was first born, he was in the ICU, and all the nurses at the bedside literally kept him alive until all the surgeons could get there in cardiology. And so that was what drives the purpose and what drives the passion of me doing what I do. So it just kept from him going through all his surgeries and me being a bedside nurse. And then I just continued on to advance my nursing practice as an acute care nurse practitioner in cardiology, then my doctorate mainly to keep advocating for patients and advocating with legislators and things like that. So I've done the bedside nursing to now trying to advocate for patients and other nurses.
And so when your baby was born, were you already a nurse?
I was not. I was in business and had not even thought about being a nurse. And then I saw the nurses taking care of him, and I said, this is what I need to be able to do. I learned about his heart. And I did. So I went back to school after he was born and went to nursing school. So that's why I do what I do.
And perhaps that's one of the reasons you specialize in cardiology, right?
Correct.
Awesome. Wow. How's your son doing?
He is doing great. He is an author. He wrote 2 books. He graduated college. Very stable. But we now are in Nashville, Tennessee. So we're seeing his adult congenital team. And I urge everybody, the congenital patient, of course, to have a certified, accredited congenital center. And so for a long time was at Emory, and we love them. And now it's at Vanderbilt, and he has a follow-up appointment next week. So every 6 months to a year, he goes and gets an echo, and he's very stable and doing great.
Now, Monica, I know firsthand how challenging it is to balance a demanding clinical role with family life, especially when your spouse, like mine also, you had to deploy a husband. Is that correct?
Correct. How was your husband military?
Yes, 20 years in the Army, yes. Yes.
Very cool. My mom and dad and sister were all in the Army. It's very challenging, as you know.
Especially when you have little kids, right?
Yes, definitely. And thank goodness, the Marine Corps always let him be around for my son's surgery. So anytime he was in the hospital or surgeries, he would not deploy, but he deployed then to Iraq and a couple times. So, but my son was stable and older at that time. But yeah, it is very difficult being a military spouse, period. But then you could throw that in a special needs
Yeah.
child on top of that.
Yeah, something similar happened to us as well. We also have a child at the time that was born without the corpus callosum of the brain, ACC. And so that's what thankful to the military that they basically based on that, they try to keep us in the same area or keep us where we can get the medical care that we need. So thankful for all of that.
That's why you do neuro. That's very cool.
Yes. See, isn't that great? But what is interesting though, your story, what brought me to think is one of the reasons I actually went into nursing is because before I was a nurse, I started working first. I started as a receptionist in a basic cardiology practice, by the way, in Pensacola. It was cardiology consultants. I don't know if they're still there. We're right at Sacred Heart Hospital, right across from the mall. So that's where I started as a receptionist. And then from there, I moved to become a stress tech. And as I am doing my stress tech duties, I saw how the nurses work diligently. And then I realized, wow. And so I started talking to them. And then the college, Pensacola Junior College is right across the street. So I'm like, okay, I work here the next day. I go out there at night and so on. And that's kind of like how it all started. Yeah.
Yeah, that is so funny. I graduated when it was PJC. That's
Yes.
college.
And they changed the name.
So now it's like college.
Yeah. Yes, I think they had just changed the name right before I left because then I moved to Alabama and that's where I went to finish my bachelor's degree. But I did most of my prerequisites there one at a time because English is my second language. I was just like, got here to the States. I did the entry level and they're like, you can be here. And I'm like, no, just start me at 0-0. I just started from like English 0-0 or whatever.
Well, I tell a lot of students that too. It's like, just keep going, one class at a time, one semester at a time, and then you're done before you know it.
Exactly. Yeah, it felt like an eternity at the time, but now looking back, I don't regret any of it because it allowed me to work full time and then go to school at night. I would take like 2-3 classes a semester, if at the most, start with one and so on. Yes. So that's one of the things about my show that I'm like, oh my goodness, people are going to think I'm crazy, but with the people like you that come in here, the guests that come into my show, for some reason, I always find something in common. We always have something in common. That just it gets me I don't know if it's courage or the desire to keep on going. I have realized that there's so much more that connects us more than, divide us in so many ways, no matter where we come from. You're also an adjunct faculty member, right? In the MP program. Is that correct?
I am. I do. I teach health policy and leadership and all the P's, pharmacology, pathophys, so advanced pathophysiology, pharmacology. I'm teaching pharmacology this summer semester, but then an advanced health assessment. So anything they need, but my love is health policy and leadership. That's what I love teaching the young nurses coming in to be able to be the voice, the expert in the room, anything medical. They're legislators, they're not medical people. So it's when you go in as a nurse, and a nurse practitioner, that you are the expert in the room for anything a patient needs or other nurse practitioners need, things like that. So I love teaching health policy.
That is beautiful. Also, looking back as well, my nurse practitioner instructor. So I was in my BSN program and I have doctors in nursing practice who were like, let's say, practicing like half time in their, pediatrics or whatever their specialty was. And they will come to teachers of us. And they were my inspiration as well. Because I used to say, well, when I grow up, I want to be like you. And so it's amazing how much we can inspire our younger generation.
Yeah, definitely.
Yes.
I still have students email me, text me, or if I see them out somewhere, how much. Yeah. And we don't realize at times that we inspire by them looking at us, listening to us teaching them. Are you faculty too? Do you teach an NP program?
I am not. I actually do have a master's in nursing education. I have not. That was one of the things I wanted to do, but for some reason I have, because life happens and whatnot. And then maybe in the future, I think probably what I'm doing now is. Yes.
But such an asset with your background, mainly the passion and the purpose that you have going in, being bilingual, huge need, of course. And you'd be a great instructor for neurology and
Yes. I do have a
Yeah.
master's in nursing education. And then after that is when I went and got the postmaster's as a nurse practitioner. But
cool.
but I graduated during the pandemic. And so it was a little challenging to kind of get. And my first, of course, was primary care. And I am been in neurology now 1 year. So I want to give myself more time into it. It was a transition from primary care. I don't know if you're familiar, but primary care is it's going through some challenges right now. There's so many,
especially in the state of Florida. I mean, I'm in Tennessee now, but I just moved here 2 days here. So, but definitely in the state of Florida, we were not full practice authority, and we did get autonomous practice, but only for primary care. So NPs can practice autonomously after a certain amount of time and after a certain amount of education, credits, and things like that in their life.
It is much worse in Texas. We're still doing agreements with physicians and so on. We are so restricted. And so that doesn't help. That does not help us. It doesn't help the public. There is so much more that goes into that,
Well, I'm
Training
acute
and so on.
care. So I'm critical care. So anything I do, I need a physician protocol.
Right.
So, and some of the things that I do in the hospital, I couldn't do without my physicians. So,
Right.
yeah, we would love a full practice authority state. But yeah, it's a challenge.
It is.
In a lot more states.
Yes. Perhaps in acute care, you work very, very closely with physicians. They're right there with you. It's interesting because when you work in clinic, although the physicians might be there, it's like everybody's doing their own thing. And you pretty much end up doing the same thing that the physicians are doing, just minus all the restrictions, that they kind of, it can be quite the bureaucracy.
The whole couple of years, jumped back and forth from inpatient to clinics. I was
Yes.
back and forth to cardiology clinic, but now it's cardiology and hospitalist. So as a hospitalist, busy admitting. Practitioners definitely need full practice.
Yeah. So again, the whole advocacy, which by the way, beyond the hospital walls, you've done incredible outreach. I mean, I understand you work at free clinics because
Correct.
you educate communities, minorities on cardiovascular health, which is such an important thing to do. And also perhaps talking to legislators, regarding congenital heart disease and all the research funding and so on. So to me, that's very powerful work.
I love it, the outreach, and I get a lot just going to the free clinic, and everybody should do it. Every nurse practitioner, a few hours a month, and it will change your life. I love seeing patients. They're so grateful for one, but we did the free clinic. It was me and a physician that's OBGYN, actually. She and the director of the clinic wrote a grant and got $100,000 to do outreach in minority communities. You'd be surprised at how many in the community do not know their blood pressure. In general, people just don't want to know their blood pressure, so they never take it. They don't go get their labs at a primary care. They don't get their normal labs. They don't get their blood pressure done. They don't know their medications, things like that. So us doing the outreach for a year, thank goodness we had a great nurse on our team, and she kept great, amazing data. How many people in the community we reached, how we did our educations, how we did the seminars. We would go to community centers and barbershops, wherever they wanted us to meet and go teach cardiology. We would go teach them cardiovascular preventative care and tell them to get their cholesterols checked, to stop smoking. Some people don't know what a good cholesterol is.
Right.
Things like that. So just doing that outreach in the community. And the main thing that I really stressed was the signs and symptoms. If you or a family member having a stroke or heart attack, things like that. And they loved it. The community loved it. We love teaching them.
That is so awesome. So one of the things, I'm not going to say that I currently work in an underserved population community necessarily, like middle class or so. But to me, one of the things I see is pair that, right? What you were mentioning, the lack of understanding and so on, and the medical illiteracy with this other emerging new technologies that we have. We have something that I call it Dr. Google, right? So what people do is they basically go into their computer, they go into their phone, and they just type, and then they get all this information that it's they come to me and now they're in this state of panic, fear, anxiety. And I literally sit down and say, listen, yes, I understand that you got this information. And I explain them there's a reason why we medical professions are still here, no matter how much technology, because there's something called that they don't understand. It's critical care. It's critical understanding. It's the analysis. It's putting together the whole history. So a lot of teaching goes into that as well.
We use our clinical judgment. We use our critical thinking skills, the clinical reasoning. A lot of people just read something, but we need to be able to explain it to them. The clinical judgment behind it, why we're doing something. And cardiology and neurology and all the specialties we use guideline directed medical therapies that are tested and studied, and it is up to us to do all the education.
The EBP, the base practice, all those things that the communities are not, the people in general not aware of it. But let me ask you this, what are some strategies that you have found most effective when engaging with these underserving communities in heart health?
That's a good question, because we have to first get their trust. And that's what you're doing every time you see a patient. You're talking to them, and just to let them talk, which nurse practitioners do great. We listen and we take into account everything that they want to tell us. And I think that builds the trust when any provider goes in and just tells you what you're going to be doing and taking, things like that, and doesn't take the time to listen, that destroys a lot of trust. So when we as nurse practitioners have that patient-centered approach and let the patient be involved in their care and explain to them what that bottom number of your blood pressure, that's when your heart should be resting. It needs to be lower so it can rest. When we explain stuff to them, and when I say them, just the community in general, whoever our patients. So I think that's a big thing. When they see that you're really wanting to listen and take the time and builds up trust, that's a hurdle that we get over, and they understand why we're doing what we're doing. So just the education in general and the preventative care, and you tell them, I'm trying to keep you healthy longer and have a good quality of life and for positive outcomes. You tell them why you're giving them this education and build that trust. And I come back to that because that is huge. And I hear that all the time. They're like, no provider ever listened to me before, or no provider ever. So I'm sure you hear that all the time too. It's like they get frustrated. And then when they get frustrated and don't have trust, then they're not going to listen. They're not going to be compliant or do. Yeah. So
it is interesting. It's interesting because most people don't know that somehow, I don't know how it is where you practice, but the system is built where physicians really don't have the time. And somehow we have a little bit of extra time. I don't know. For example, if in my clinic, a physician would see, 30 patients a day, maybe I would only see like 23. So they space them out a little bit. It gives a little bit more extra time, which is to our benefit and to the benefit of the patient. And so the patient doesn't feel as rushed or like they're just another number. Also, the nursing model, we're based on this whole education, because unfortunately we know that nothing with, the physicians, they're educated on disease, and the disease per se, the pathology of it. I'm very happy to be a nurse practitioner in many, many ways. I know that the community, my patients, they're very, very thankful for it. So
once they understand that you understand and that you care.
Exactly. And so another thing I was going to mention is that our commitment shines when we tell our patients, and especially in your son's case, that he has already touched so many lives through your work. I mean, like you said, he has graduated college. He's become an author himself. It's an inspiration. But let me ask you this. How does it feel to see the ripple effect of your advocacy and care in both your family and professional circles?
It is incredible to be able to do what I do. It is life-altering and changing. I told my son many, many times, he has saved so many people through me. That he was born, which gave me a purpose, and he's why I do what I do. But seeing actual change in a patient and them coming back to me and improving their quality of life, improving their health, just by education, just by, me and you went to school and we learned how to care for a patient. And that is a very powerful thing to be able to do.
Yes.
So being able to see it. And then as the advocacy, for me going to DC a lot, or me going to the state capitol and talking to legislators and getting even appropriations or funding, American Heart Association will call me and go, can you go talk to your senator? We really need $500,000 appropriations or funding for education for American Heart this year. Right away, I go whenever they call, and I go to DC Capitol with American College of Cardiology, things like that. We are the voice, we are the expert to these legislators and tell them what we need, why we need it, who it's going to impact, public health, why we're doing what we're doing type thing. So I love, and that's why I love doing what I do, because you do see the impact. That it does matter, and you make changes in healthcare. You go and you tell them, we need this. This is why we need this. And it could be something simple. Any nurses out there, nurse practitioners, have gone to mayors before, city council before, things like that, and said, we need a bus route to my free clinic. You can't take that bus route away. Things like that. Or can you just give a something that you need locally, or even at a unit level, an institution level? You can be an advocate at any level. Really stressing that to all new nurses and nurse practitioners, just keep advocating for quality improvement.
Absolutely. And a question on that, what advice would you give to an NP just starting out who dreams on blending clinical practice, education, and advocacy?
To go and meet with their legislators, learn who their legislators are, know what you want to advocate for, and just practice that 3-minute kind of elevator speech. You're not going to get everything you ask for, but you will get nothing if you don't ask. So don't be afraid to ask. Have your ask ready. Have it ready to just, in 3 minutes or less, go, this is why we need it. This is who it's going to impact. Your constituents need it. Your state needs it. Whatever level, your federal level needs it. Have it ready and concise, and be prepared. Have their questions already in your mind to answer, because they're going to come back with physical things. Can we afford it? How much does it cost? What is this going to take? So have all those questions already in your head and ready to answer. And that makes you the expert. So knowledge is power.
Absolutely. Monica, is there anything I have not asked you? Or let's say, is there something that if you were to tell our listeners that they can take home with, one thing that they could take with?
Pursue your passion, and pursue, just like you said, you started one class at a time. If, we need good nurses, we need great nurse practitioners, primary care, and, all the technology coming up, advances in technology. Follow your dream, follow your heart, follow your passion, your purpose, and take care of patients, because it's a wonderful thing to be able to do.
Absolutely, it is. Monica, how can the listeners get in touch with you? How can they reach out to you?
Hey, podcast, and I need to have you on the podcast because you're an amazing story.
Thank you.
TheRealMonicaSanford.com.
Okay.
That's my podcast, and they can find all my social media pages on there. Monica Sanford on LinkedIn and Facebook, and my show on Spotify. And it was actually picked up for national, and I just heard it was going to be airing in New Jersey radio, so that's cool. But yeah, it's a place for veterans radio, Reach Across America Radio nationally. Comes out actually tonight or tomorrow. It is moving. But the Monica Sanford Show.
Wow.
Correct. Then Apple.
Perfect. It's wonderful. I'll be listening to it for sure. That's what I've been doing. I've been listening and reading my guest authors' books and so on. I'm just so thankful for each one of, yes.
Are you writing a book?
So
Are you writing?
I wrote a book. I got a book. Yeah.
Yeah.
In fact, that's how the podcast got started. That's how my podcast got started, because I wanted to share the message of the book. The title is The Courage to Succeed, A True American Dream. So it talks about my story growing up in Colombia and how I became a nurse and a family and so on. It's about empowering younger generations, to tell them that, hey, you have the courage to succeed, to do whatever it is that you want to do in life. Do you want to become a nurse? You want whatever it is. So in other words, don't let Nothing,
Right.
not even a language or a culture or a barrier, whatever it is that this society wants to impose. And
I started out very slowly taking, but I have 2 babies,
yes,
one special needs, one, my husband's in the Marine Corps gone. You just do what you got to do. And
exactly. Yeah, because it took me like 10 years to graduate. Seriously, because by the time, yeah, exactly, take a class here, there, but you don't give up. You keep believing it. And then, you finish a bachelor's and then finish my master's. And then again, you become a nurse practitioner. I don't know if you had the same experience, but it was very difficult to find preceptors.
I was very lucky. At Georgetown, they found them for us.
Some schools did that for me. It's difficult. And then graduated in the middle of a pandemic.
That was a crazy time. It's in the ER. I was in the ER at Sacred. Very busy.
Yeah. Well, thank you so much. It's been such an insightful conversation. Thank you for sharing your journey, your challenges, your victories.
Thank you for having
everything.
me.
I really appreciate you very, very much. I'll be posting on our website. I will share with you and to our listeners. So thank you, Monica. Have a great day
Thank
and
you
continue
so
doing
much
what
for
you're
having
doing. All right. Thank you. Bye.
If this episode spoke to you, if it sparked a thought, a feeling, or a shift, I invite you to subscribe to my channel so you don't miss an episode. Visit www.rosabelzohfeld.com. Here on Rosabel Unscripted, we dive deep into real stories, mindful moments, and conversations that matter. Every week, we explore themes like resilience, healing, transformation, and the courage to rewrite your own story. So if you're ready to grow, reflect, and walk this journey with an open heart, hit that subscribe button, give the video a like, and drop a comment. I'd love to hear your thoughts. Let's keep the conversation going. There are new episodes every week.